New CDC data out today shows measles cases have topped 900 nationwide, with 3 reported deaths.
12 outbreaks have been linked to 30 states. WIO health reporter Grace Habe is here in the studio. Grace, these numbers are something the state and local officials are watching very closely.
Yeah, and something we've been watching here within our own station very closely as well. And we've continued to check in with the state health department. And DHHS just this week tells us that the state lab did test 1 suspected measles sample within the past 2 weeks, which came back negative. It's good news, but health officials say that likely won't remain the case much longer.
North Carolina, in a state of alert.
Frontline clinicians, nurses, people working in emergency rooms, ambulances, all the way up to administrators.
Across UNC, Duke, and Wake Med hospitals, staff at all levels are undergoing more trainings and reviewing protocols to be prepared for measles.
It's really difficult to diagnose something if you don't think about it.
You know, it's not all spots. So some people come in before they get the spots and they have a sore throat or they have a high fever or they feel bad.
Our state has only reported 5 measles cases in the last decade, which means most medical personnel haven't yet encountered the virus firsthand. Early symptoms can also mimic other illnesses. It's why doctors say immediately isolating any suspected case is crucial.
As soon as we can, we get them into a room where the air is being filtered and pulled into the room rather than going out.
The virus spreads easily and can cause serious health complications, especially for children under 5 years old.
If you have a room of 30 kids and there are 5 of them that are susceptible, if a case comes in and they're in there for any substantial length of time, those kids are going to get it.
The 3 local hospital systems share they don't anticipate the need to convert wings solely for measles care, but say COVID created clear blueprints for how to do so, if that becomes necessary.
When we talk about vaccination goals, we hear the number 95% a lot. Why is that important when we're talking about measles?
So if 95% of a community is vaccinated for something like measles, it would be enough to stop the spread of the virus, which would be ideal. The concern right now in North Carolina, though, is that so many counties are not at that level. This map shows vaccination compliance for kindergartners as of last school year. All of the darker shades of blue mean that more kids have been vaccinated, including measles. But statewide, though, we're only at about a 93% compliance rate. And here in Wake County, that is about the same as well, and slightly even lower in Durham. So a lot of people at risk.
That translates into thousands of children in this state and others at risk. Thank you, Grace. Now, we know parents may have concerns and questions about the measles vaccination. You can find the answers to a lot of those questions right now on WRL.com. Just look under the Health tab for our latest measles coverage as we continue to track the viral spread.